All right, while waiting for the questions, I'm going to talk about Brandon's presentation. His presentation's title is Because Earlier is Better. Brandon is the CFO of Dexafit US. His main responsibility is identifying strategic partnership opportunities for the company. He brings over 8 years of experience, which includes a stint in equity research, equity trading, and investment banking. His goal at Dexafit is to do for health and wellness what he saw happen in finance when technology disrupted traditional financial methods. Wearables present a unique opportunity to collect activity data about what people are doing to improve their health, but they currently lack reliable insights into what effect specific activities have on health. Bridging the gap between someone's health history and wearable data with medical grade data from Dexafit's technology will create a unique opportunity to offer scientifically validated health solutions at scale. Okay, so right now I'm going to invite Brandon to talk to us. Brandon, are you here?
Yep, I'm here.
Awesome. All right, let me just share your presentation. Is this correct?
Perfect. There we go.
Awesome.
All right. Thank you, James. Happy to be here and participate. Now, if you want to go to this first slide here. All right. So I'll be talking about just a couple of topics here today. Adam talked about how Dexfit was started and its progression over the past decade or so almost now. And then James has really given you an idea of what the journey looks like from the perspective of a Dexafit customer, having this testing done yourself, how it looks like in the app, and the data that you can expect. And then I'll be talking a bit about now how Dexafit is looking towards the future. So we'll be talking about the future of Dexafit, kind of the testing facilities and the physical representation of Dexafit, as well as the future of Dexafit AI, the software components and tool sets that we're building both in the Dexafit app, among other tools, to help the individual, pros, and industry, whether it's employers or insurance or whoever, to make as much use of this information as we can. And then last, the community benefit. Where do the Dexafit layers, where does Dexafit layer into existing infrastructure and our plan to support communities with better tools? So over the years, we've tried our best to listen to individual client experiences, identify partnerships that have had outsized success compared to those that didn't do as well, to really craft everything that we've built to support the areas of success that really are easy to replicate, and to help more and more people achieve the success that they're looking for. So go to the next slide here. We'll start with the future of Dexafit. So when it comes to the future of Dexafit in its physical state, there's a couple things that we'll focus on. Expanding access is number one. A key concern with any innovation in healthcare is equitable access to services. And the Dexafit software approach is really our way of making it much easier to access this sort of information without having to have experts in your region or having to rely on whether it's a physician or a doctor that specializes in this sort of testing in your specific region. Just being able to have this data with the testing locally, and then being able to access existing programs or wellness pros in a digital marketplace that are showing that, hey, I'm doing this with all these different clients. This is the success we're seeing, and not having to require them to be, within a couple miles of you to be able to work with them. Expanding that relationship to something more digital to allow now a global audience. Infrastructure is a way to help maintain lower cost and much wider spread access. The second portion will be the Pro Marketplace, and the Pro Marketplace is going to be a feature that's launching in the Dexfit app that is meant to connect, again, these individuals that are coming in and having this testing done with wellness pros that are looking to help those individuals achieve some aspect of their preventative health goals or just their performance and fitness goals. Now, the goals that someone is shooting for will be dependent on what their journey is looking like, and that's going to be dependent on what their baseline testing looks like. And so the idea here is that someone will have their baseline testing, and then we'll constrain the wellness pros that are an ideal fit for them based on the opportunities that they have based on their data. But we'll go into more why this is important to be able to match people up to a wellness pro that's a good fit for them based on where they are when we get to those slides. And then the last piece of the future of Dexafit will be app features that are really kind of specifically focused around the testing that's currently being done, and then the tools that allow you to make better use of that testing through time to ensure that more and more people are able to replicate the success that we've seen with many of our Dexafit clients over the years. And then again, really adding superpowers to the wellness pros that have also helped those clients meet their goals over time. So James, I'm going to go to the next slide here. Okay, so expanding access. The first part I want to start with is this existing infrastructure piece. Now, one of the exciting things about DEXA technology, as well as cardiopulmonary testing, the CPET testing, is that these are tools and devices that have been around for decades now. This is a mature medical equipment technology. It exists in many hospitals and many kind of individual private clinics throughout the globe, though it's often not really presented that way on perhaps their websites, where it's not their kind of primary draw. But it's a mature industry that has a wide service network and a large install base. But that install base is not readily available to consumers to know that, all right, this is available and I can access it and it's low cost. And the data on those systems is often not in a format that is conducive for individuals to understand very easily. And so this presents a really unique opportunity where a lot of the equipment to do this testing is already out there, but it's not set up in a way to make it easy for people to get access to it and then have their results in a way that makes sense to them over time. So now we can take our software that we've developed and pair it up with the existing system so that we can both send customers to them so that people know that this is available at these sites that maybe were already in their neighborhood without them knowing. And then being able to pull that data back into the Dexafit app so that they can, again, make better sense of it by allowing us to use our artificial intelligence and machine learning to abstract away a lot of the complexity and help present essentially a roadmap of here's where you should be going moving forward from here. So this is something that allows us to scale much more quickly, because instead of having to go out and sell hardware equipment and say this is something that's going to be a big benefit to you, buy this equipment and then pair the software up with it, there's already a lot of facilities that already have the equipment, and often it's just very underutilized outside of their typical workflow. And so they have a lot of availability to allow more people to come in at an effective cost and get more out of it, because a lot of the facilities do the testing, but they don't do anything with the results, or it would be very expensive to work with a physician with the results. And so it never occurred to them that they could do this other pathway where they do the testing that would feed into this Dexfit app. And then the app is responsible for helping the individual understand the results and then put those results to work with whether it's a wellness pro or just within a framework that allows them to succeed. So layering on top of existing infrastructure is a way for us to scale much more rapidly. Alongside that, the software install, kind of like I alluded to, something that's very quick. Again, these systems are very uniform and very similar. The biggest kind of obstacle is whether it's in a hospital environment or other environment where there's some specific IT restrictions that we need to accommodate, which we've done in the past. But generally, the software install is something like less than 30 minutes. This is very quick. It's easy to get up and running, and it's easy to train the technologist for how to export the data to ensure that it's getting to the app. And we continue to refine that process as well. So very easy to get up and running. And again, this is equipment that's already installed, and all of a sudden within 30-minute appointment, you're now a new node on our Dexafit app that can send app data or equipment data to our platform. And then finally, low cost. So again, since we're layering on top of existing infrastructure, the software isn't something where we need to send someone out and have all sorts of travel costs and install labor and things like that. It keeps the cost down quite a bit from in terms of the marginal cost of getting the software on these systems from our side. And then again, these are systems that are already installed, they're often underutilized. And so any incremental business that gets added on top of these systems is really just a bonus in a lot of ways. And so it's a very compelling offer to facilities that already have this equipment installed because they can increase their revenue with essentially no work on their side. And so all of these things combine into allowing us to rapidly expand access across the globe and keep costs down. Again, if this is something that was only available to just very wealthy people, you're not really making that big of a difference. And so this is something that allows us to keep costs very low and very accessible for a wide range of people. Okay, next slide here. Okay, so the Pro Marketplace is something we're really excited about. Now, there's kind of a journey to this as well that expands upon the journey that Adam and James have talked a little bit about. The idea here is that a customer would start with their baseline testing, and then that's going to identify their current health status, right? Are they looking to be losing fat? Are they looking to put on lean mass? How much visceral fat do they have? Where's their bone density? All of these components that are really important for understanding what their goals should really be focusing on. Because many people don't really know what their goals should be. It's unclear if they should be focusing on losing fat or putting on lean mass. And a lot of times someone says, I just want to be this % body fat because that sounds like it's impressive. But it's not because they care about being at that body fat percentage. It's just because they didn't have a specific goal that they felt strongly about. And so the idea here is, again, to constrain the expectations of what someone's goal should be to something that's both realistic and achievable based on what their starting point is. And part of that process is then showing, all right, here are reasonable goals, and then here's how you accomplish those goals. And accomplishing goals can really be looked at as either a self-starter component or individuals that need some spectrum of assistance with that. And so individuals, in the past in particular, people that were very analytical and kind of self-starters were big Dexafit clients early on because they were the people that were most ready to take in the data after a scan and just do their own thing with it. But that's not most people. Most people will want some sort of framework to work within to ensure that they're able to achieve success, because it's difficult to be an expert in all of these things. And there's so much bad information out on the internet and social media that ends up really confusing people and makes it feel like they're unable to succeed because they don't know where to start. And being able to constrain people to programs or wellness pros that are really, by an evidence-based proxy of when individuals similar to you work with these wellness pros or these programs, this is the sort of spectrum of success that we typically see over time. And then these are programs that typically don't work for people like you. And at first we might not know why, but over time we'll hopefully have more and more data that can start to help us figure out why is it exactly that this program or this person works much better than this other sort of program. But the key is, it's not really important to an individual why a program doesn't work. What's important is this program is most likely to work for you, and you don't need to think about it because we only have so much cognitive capacity that we can utilize. And when people feel overwhelmed with the decision-making and information available to them, it's very difficult to proceed without any sort of fallback. People get stuck because it's paralysis by analysis. So constrain the programs that are available to them to the ones that are most likely to help them succeed. And then the final component of this is now assess progress. And Adam talked about this a little bit, where you want to make sure that you're not coming in a year or 2 years later, not having any follow-ups, because you may not be seeing the progress that you were hoping for. If you come back a year later or 2 years later, we've seen people that they're either exactly the same or they're worse off. And at that point, people tend to have an emotional response to that because it feels like a personal failing that, I thought everything that I was doing over the past year or two was working, and it finds out that it was not working. It's hard to not take that personally if you feel like you were doing all the right things. But the key is to use this as just an objective way to overcome our human biases that we experience with our own consciousness and say, okay, this is going to tell me whether or not I'm on the right track. Doesn't say anything about me personally. And this is going to help me get to the goal that I want to get on, or the program that's the best fit for me. And eliminate those that are not a good fit for you. For whatever reason, they're not a good fit. And so that's why staying closer to 3 to 6 months is really a better timeline for that follow-up process, because 3 to 6 months, particularly 3 months, is really a long enough time frame to see meaningful change, but not so long where it's now decoupled from any number of things you might have tried. We want to keep it very tightly coupled with, I did my baseline, this is the program that I followed, and then this was the outcome of that program. And when you have that tightly linked, you now have a much better idea of what is it exactly for these programs that is helping people get the success that we want when it comes to their goals. And once people get that first good follow-up scan, now they're starting to get hooked. They get that confidence that, hey, I can actually do this. This isn't as hard as I thought it was. But if people get too focused day to day of, oh, am I making progress? Am I making progress? How's my scale weight changing? Then they can get discouraged if, you know, one day their weight's up, the next day their weight's down. They're just kind of doing this yo-yo, which is expected because, you know, progress is generally not linear, kind of comes in spurts and stops and starts. But the key is to trust the process over a long enough time frame to, you know, get an idea of if this is actually working or not. There's just too much day-to-day variability for just weighing yourself every day to having that be any sort of useful information on whether or not you should continue the program or not. So the key is, again, constrain the program to those that are most likely to be successful for you, trust the process over that period, and then do the follow-up testing to evaluate whether or not that process was effective. So we're really excited about this upcoming feature here and expanding the pros and programs that'll be available in that marketplace. Next slide, James. And when it comes to future app features, you know, we're always on the lookout for what's helping, what's not helping, and what seems to be missing for individuals when they're doing testing. And so Adam alluded to this a little bit earlier, but blood testing biomarkers will be available in the app soon here. So whether that's being able to purchase the lab testing or being able to import lab testing you already have had done, and then being able to see how that's progressing over time, and whether or not that's within an optimal range or more high risk range, whether that's high or low. And part of that as well will be, you know, how should I be tracking that blood testing over time? What would valuable biomarkers be for me specifically within, say, the next 6 months or the next years? What are things that I should be keeping an eye on? And then realistic goal planning. This is something that, you know, we've thought a lot about as well. The current implementation of this in the Dexfit app looks like as it does on this screenshot, where it shows you where you are now, but then you can adjust these sliders to you know, left or right based on the metric of either increasing or decreasing body fat percentage, lean mass, visceral fat, so on and so forth, to get an idea of, all right, if I saw this change, you know, what is the impact for this metric or this metric? And we do set some basic default goals based on where you currently are to make sure it's not too you know, ambitious of a goal, but we're looking to refine that in the future where, you know, we've gotten to the point where we have enough data where we can say, based on people that are similar to you that have had a baseline, this is what progress looks like over a duration of 3 months, 6 months, or 12 months. And again, constraining people to what the actual possible scope of outcomes typically looks like. So letting people know that this is what average progress looks like over that time frame, this is what outstanding progress looks like, and this is where people tend to regress, or this is, you know, how bad it can get within 3 months, to give people, again, a better idea of this is what the scope of possibility looks like, and this is what we should be shooting for and being happy with that. And, you know, having improper expectations based on, you know, oftentimes misinformation can set people up to be really frustrated with their progress, because, you know, they might be thinking that, oh, well, I saw this program on social media that said I could lose 20 pounds of fat this month, and then they don't do that, then they're upset. But that was never a realistic option for them in most cases. So being able to set realistic goals that is repeatably achievable is what keeps people on track and within their scope of potential ability, rather than, you know, just some generic goal that isn't made with them in mind. In addition to that, you know, various wellness pro tools to help with the wellness pros and programs that are looking to assist individuals make progress. So being able to manage your relationship with individual clients at a larger scale to keep an eye on, you know, activity from wearable data, you know, whether it's biomarkers or just the testing in general, being able to incorporate all of that into a dashboard with alerts and things like that for the wellness pro, so that they can make sure that they're doing as good a job as possible keeping up with what's changing in their clients' physical state and their health state, and understanding when it's important for them to have more of a personal touch, and then when someone's really kind of established a routine with their program and can follow that effectively over time. As well, recommended testing, that's kind of a little bit with what I was saying with the biomarkers, but one of the things that I've found over the years is that many people do not have, at least in the United States, do not have a effective relationship with a primary care physician or just a healthcare professional in general, in their 20s or often their 30s as well. And that's really a crucial time to be establishing your kind of peak maturity health status data points. But preventative healthcare is not really based around actually doing preventative care. It's at best, it's helping us kind of manage the onset of disease progression, so managing diabetes risk, cardiovascular disease risk, but it's really not set up to help people with understanding what optimal health looks like. And so being able to provide a framework for individuals to understand not only how do I help minimize my preventative health risks, how do I actually optimize my health to have the best longevity and health span that I can. And so being able to take someone's demographic data, their height, weight, sex, and then their current Dexafit testing data to say, here's where you are, here's where your risks are, and then here's how we get you towards more of your optimal, essentially, representation of your entire body, whether that's Dexafit testing, blood markers, or any range of the testing that we do to fully capture that macro health state to what your kind of peak potential is. And alongside that, what sort of testing should people be doing, whether that's Dexafit testing or biomarker blood tests as well. So you have these sorts of things at your peak maturity and can track how that's changing as we age, which is really important, especially with something like bone density, where if you're not being tested for bone density until 60 years old, and you find out you have low bone density, it's not clear if that's something that has occurred within the past 6 months or a year, or was that happening 30 years ago? And so having this roadmap of your body, all of these really important health metrics of your body from the time of a very young age really helps us have a better understanding of how is our body changing through time, how is our risk profile changing through time, and are we doing as much as we can to optimize our health to help us give the best quality of life that we can achieve. And then kind of alongside that, the disease risk as well, where not everyone's going to be necessarily even focused on getting as much optimal body composition or health stats as they can, but at the very least minimizing their disease risk. And part of minimizing disease risk is understanding what is my disease risk. And when it comes to most of the preventative health diseases, things like cardiovascular disease, type 2 diabetes, osteoporosis, these are things that are very adequately described by DEXA testing and cardiopulmonary testing. And this gives us a very great opportunity to establish, this is your risk of heart disease, this is your risk of type 2 diabetes. If you stay on this path, this is what we are expecting your trajectory to look like over the next 5 or 10 years. And this is what you can do to manage that. And one of the issues with something like, say, A1C testing for type 2 diabetes is that it's become a metric that people tend to not really understand that much, where, if I'm below this arbitrary cutoff, then I don't have diabetes and therefore I'm fine. And unfortunately, that's true until it's not true, because type 2 diabetes is a progressive disease state where it just gets bad enough that now your A1C is above this, somewhat arbitrary threshold of metabolic dysfunction. And when you've gotten to that threshold, you've no longer prevented anything. And it's not exactly clear that you can even get back to 100% optimization of that metabolic process. You are now trying to undo the damage that you've already caused. So these are things that are important to understand, that, again, based on your macro manifestation of your body composition and your health state, these are what the risks are looking like. And if you stay on this path, we can show, based on people that are very similar to you, this is what that turns into for disease, which should help give people a better understanding of, if I continue to follow this path day to day, this is what will most likely happen, which makes it hopefully more real to people and more kind of certain in front of their face that, okay, I need to be addressing this. But not only do I need to be addressing this, it seems like I have a good pathway or framework to address that. But if you just tell someone that this is your risk, good luck, then they tend to be much more likely to just discard it and not think about it because they feel overwhelmed with how do I actually make the changes that I need to make to reduce my risk. And then next slide. Now, with the future of Dexafit AI, I touched on a little bit of some of this stuff, but this is where we start to get into some really exciting things to help that establish that framework of how people succeed. So disease detection will be an important component of that. And we'll be moving into clinical validation studies, first with coronary artery disease, but also followed by other commonly preventable diseases, like I mentioned, such as type 2 diabetes, osteoporosis, potentially cancer, and more as well. But being able to take the macro view of your entire body, this is how your body composition is playing out. All of these things are very, very much a large scale representation of your health status, rather than only individual components. And so being able to tie everything together at small scales all the way up to the largest scale of your entire body gives us a much better understanding of how these pieces are playing together and producing disease risk over time. So being able to validate our existing risk assessment tools with current gold standards, such as, in the case of coronary artery disease, a CT scan of the arteries to look at blockages and things like that, gives us an opportunity to address those risks, but after we've shown this is the accuracy and its agreement with current gold standard. Next, I'll talk about patient empowerment. So as I have discussed a little bit, patients are often overwhelmed with the amount of information required to understand their health status. It's not clear to people that when I go to an appointment and talk to the physician, have all this testing done, what does any of this data mean? There's so many of the tests are done kind of as on an ad hoc basis. They're kind of siloed as individual tests. They're not meant to talk to each other. They're meant to be interpreted generally by a physician or other healthcare professional. And unfortunately, what that produces is confusion, frustration, and poor compliance with the prescribed interventions because people don't fundamentally understand what it is that they're struggling with and then how to either reverse or prevent the progression of these diseases. And so patients really deserve a framework that allows them to succeed without having to be an expert. People should be able to have all this data presented to them in a way that allows them to say, yep, I get it. I know what I need to do. I know what's causing me to be in the state that I'm in right now. And I feel like I can think about these things in a way that I understand. And when people have that empowerment and agency, they're much more likely to succeed than if they just don't understand where anything is. And as a result, can just ignore it essentially, or are more likely to ignore it. And then the last piece for this section will be population health. So when large scale adoption of something like this occurs, that allows for a vast potential understanding of population health trends. So AI will allow for real-time monitoring of population health, and then starting to understand what are the behaviors and programs that actually produce positive change in health status for the largest number of people over time. And so being able to allocate resources in a structure that allows you to address the most common behaviors and programs that are going to help you reduce risk for your population, and then being able to set aside other resources for some of the less common cases as well. But for population health, you really can't do these things on any sort of effective scale based on the data that's commonly used today, because the data such as BMI, basic height and weight, basic blood labs, things like that, fundamentally does not give you enough understanding of data of that person's health status to really make the most effective decision that you otherwise could. And the amount of time and money it costs to get that existing data that industry is often going off of can be replaced very easily with equivalent Dexafit testing, both similar in cost and oftentimes the same or less amount of time required. So there's some really exciting things that can be done with population health. Now, next slide here, James. Now, with disease detection, like I said, we'll be shifting into clinical studies here very soon. And we'll be starting with coronary artery disease. And one of the reasons that we're really excited about that is because there isn't a test such as like A1C with type 2 diabetes that really tells someone this is your risk or this is your status with coronary artery disease specifically, or cardiovascular disease more broadly. The current gold standard for assessing somebody's blockage or risk of coronary artery disease is doing a CT scan of the heart and arteries and looking for specific blockages, how much is that blockage in relation to the total artery diameter, things like that, which would then give the physicians an ability to know, is this someone that would be ideally suited for a stent or a bypass, and how has that blockage progressed over time. But unfortunately with CT, it's very high radiation, all in one dose, very uncomfortable procedure, and it's very expensive, and it's very intimidating. And so a lot of times people put it off until they're now experiencing chest pains, and their physician is recommending a CT scan to get an understanding of what their blockage is or what the progression of disease is. But when you go in there, it's very hospital oriented. You're in a gown, you're in this big donut machine. They're putting oftentimes contrast dye into your blood. And so it's a very intimidating and uncomfortable experience, which is very scary to people. And when you get to the point, because we want to reduce radiation exposure for patients, and CT is such a high radiation exposure, it's not something that can be done much earlier and frequently over time, because the radiation exposure is just far too high for that to be feasible. So you just cannot use that for screening people over time. And as a result, it's basically only people that are really at high risk or a high likelihood of having coronary artery disease that are having this sort of procedure done to screen them for artery blockages. And again, this is an example of, at this point, you're not really preventing anything. You haven't given people a framework to stop this from happening. You're only now getting them in the pipeline to do other procedures that the hospital is able to do to help manage the progression of the disease. And so being able to use DEXA and our other testing to start essentially screening people and helping them understand their risk progression from a much younger age allows you to basically totally circumvent that existing status quo and actually give people a chance of addressing their behaviors or habits that would lead to that coronary artery disease. Now, type 2 diabetes is an example of, there is A1C, there is an existing sort of test that's very cost effective and easy to do that gives you the diagnosis of, does this person have type 2 diabetes or not? But the issue with that is that, again, this is very similar to coronary artery disease, where by the time you're doing A1C and it's saying that you're above this threshold, you have not prevented anything. You are now trying to reverse the damage of this disease state, which now puts you at a disadvantage, because both the habits that you've built up to that point have become much more solidified in your brain. And then you are now no longer trying to get back to 100% health. You're trying to get to some place that's at least not as much of disease progression, which is a much more difficult place to work from. And so if you can tell people that, okay, say you're 30 years old, you've got obesity, you've got a lot of visceral fat, but your A1C is below the cutoff for type 2 diabetes. Being able to tell them that your likelihood of developing type 2 diabetes over, say, the next 5 or 10 years is, say, 80%, if nothing changes and you continue on this path, that hopefully makes it much more real to people that, okay, I'm really putting myself at high risk for developing this disease. And I understand that, and that's very clear to me. But now I know that there's a pathway to get off of this, and being able to show people that, hey, within just, say, 3, 6, 12 months, you can meaningfully decrease your risk without that much difficulty. As long as you start now, people often respond to that much better, because they feel like they have hope that, hey, I can actually do something about this. I can get back on the right track. But if they're 50 years old or 45 years old and they're now diagnosed with type 2 diabetes, they're at a much more difficult starting place, because they feel much more hopeless at this point, because they already have the disease. Oftentimes they're in a worse body composition state, and it's a much more difficult starting point where people don't feel like they have the ability or the agency to get back on track. So being able, again, with coronary artery disease and type 2 diabetes, being able to help people get back on track much earlier in their lifetimes is drastically able to increase their chances of success and reduction of lifetime disease risk for these preventable diseases. And then the clinical studies component is really important, because, as it stands right now, we've got plenty of really good internal data that supports our risk assessment with these things. And it's very obvious that things like body composition and cardiorespiratory fitness obviously are some of the driving factors behind preventative disease. being able to have a very clear paper that shows not only are these very highly correlated with disease risk with Dexafit testing, but this is the level of agreeableness with current gold standards such as CT or A1C. And not only does it have a high level of agreeableness with those tests, we're able to do this much more frequently and much earlier in time so that we can actually help people change their progress and have a higher chance of success. So that's really important for helping people actually manage their disease or their risk through time. And then next slide. Now, patient empowerment, I touched on a little bit, but this is something that I feel really strongly about based on the thousands of people that I've interacted with over the past 6 years or so. One of the things that I really see is that if someone comes in and they already know what they're doing, they tend to always succeed. They tend to often already be in a really good spot, or if they're in a not as good spot, they're already aware of that and they know what the plan is to get back in place. Maybe there was some event that happened in their life that kind of got them off track, but they know where they need to be and they can get back there relatively quickly. For people that never really learned how to do that and struggle with this sort of information, because this just, it's not in everyone's wheelhouse, and that's okay. They tend to be much more unsure of what their current health status is, how to proceed going forward. And a lot of these are very kind of emotional and personal obstacles that prevent them from succeeding. And this is common not just to preventative health, but for anything as it comes to how someone acts in the world. When people don't feel like they have a good understanding and a good model of how to proceed and act as an agent in the world, they tend to not be as successful, and they tend to not try as often because they're scared of failing. So a big focus is starting with easy to understand. If you set things up so that you have to be an expert to understand this, which to a large extent is the status quo within the current health framework, at least for the United States, where you go to a physician, they're the expert, they'll tell you what to do, but you don't get to really understand what it is that's going on with you. They'll tell you, take this medication or take this, do this intervention, but they don't help you understand really what's going on. And part of that is they only have so much time with you. And the other part of it is that it's difficult in a lot of ways to crunch all of this expertise down into something that's easy to digest and understand. And not everyone's a good teacher and is not good at explaining these sorts of things. But with most of the testing that we're doing, we've already shown that we can crunch most of this down into a format that's much easier to understand, much more simplified, uses language that's common to people that they can wrap their minds around, and allows people to understand it in a way that's much more intuitive. And that's something that when your focus is on specifically helping people to understand this information, you're now incentivized to set it up in a way that allows you to achieve that. But for hospitals or physicians where there's nothing that really changes their incentive structure for helping people to understand this, then they just won't really optimize for that specific component of the patient journey. But that's something that's a big opportunity to us. And when you present this information, in my experience, to individuals in a way that now gets it to click for them and they feel like they understand it, they now get this level of agency that, again, I feel like I know how to do this and I understand where I am and what I need to do. And people that have that shift in their thinking are much more likely to succeed. So that's a really important component of the preventative health experience for patients. Similar to that is a familiar user experience. Again, within the current health framework, most of the time you're getting printed reports that are very convoluted, confusing. They use jargon in it. They have, oftentimes weird units or measurements that aren't intuitive to you on a day-to-day basis. Most of the reports are meant to be shared between healthcare professionals, not with patients specifically. The patient being given their results is just kind of a unfortunate byproduct of their testing to them in most cases. And kind of in best cases, you might get access to your blood records and some of your other documents through a web dashboard. But again, it's basically still fundamentally the paper that was being used that's uploaded to a dashboard that you can see. It's not making it any easier for you to understand what's actually going on, being able to access in a way that's reliable and easy. A lot of times these websites that are built are really terrible from a customer experience standpoint. So being able to package everything into something that exists on the patient's phone, that is in a format that they understand, that is similar to other apps that they use, keeps the information content within a format that is familiar to their other day-to-day experiences. And that's often how the brain learns. It's anchored to, we best learn when we anchor concepts that are new to us to concepts that we already know. And when you present the Dexafit concepts from this sort of testing and other health tests as well, in a way that people already interact with, they're much more likely to pick these things up very quickly. And the result of all this is that hopefully you remove roadblocks to success, right? Any link along the way that produces a friction point, whether that's they don't understand the information, it's not in a way that's accessible and easy for them to understand, and it requires too much expertise to understand. All of these are specific friction points that have more and more people drop off over time. And when you look at, again, at least in the United States, the current trends, the trends are that people get more and more preventative health diseases, not less, right? It's not clear that we've had any sort of positive impacts on preventative health disease risks with the interventions that the U.S. government and employers have done over time. And so clearly what we're doing right now is just not working. And so a big part of that is helping people reduce these roadblocks so that there's less friction to their success. And the question to the audience is, when you think about your own personal experience with your health, and when you try to introspect and be honest with what's preventing me from seeing the progress that I'm looking for, what are the things that you point to and say, I wish I knew this, or, if only I had this, that would help me better understand what I need to do. Those sorts of stories are things that both I'd love to address and help us craft the product that we're building to address those concerns. And next slide, James. And then population health. When you go from just an individual that does this sort of testing to a large population of individuals doing this, now you unlock a really amazing amount of data that can help decision making on a much larger scale. So being able to monitor trends of whether it's from the perspective of a government, from all of your citizens, and how that, if it's a nationalized health service, how that impacts your health spending and health status of all of your citizens, to insurance or employers, where you want to better understand what's our expected cost going to be. Is the trend that people are getting more sick or less sick, and as a result, will that increase or decrease our spending? And then what sort of interventions or programs are actually having a meaningful impact on our population, so that we can allocate resources in a way that actually is having an impact, rather than just feeling good that we're spending money on it, even if it's not helping people. And part of that is reinforcing healthy behaviors, right? When people are doing the things that are actually reducing their health risks and helping them understand their current health status and what to be doing day to day, we should be rewarding those sorts of things by whether it's lower insurance premiums or whatever sort of format that makes sense. Being able to reward people for the behaviors that are actually helping reduce their risk and reduce their healthcare costs helps incentivize people to actually be doing that, right? If the only benefit is that I don't get sick until I'm 60 years old, but I'm 20 right now, my brain doesn't work in a way that I'm going to optimize for that. I'm going to optimize for something else that's much nearer term. And so being able to incentivize people to actually care long term to manage this, if they don't intrinsically care at a young age, it helps you get that data from a younger age, and again, get them on the right track at a younger age as well, which then helps you downstream as they get to 50, 60 years old as well, when healthcare costs start to go up. And then again, for these stakeholders, right, it's important for governments, employers, insurance, for all of these invested stakeholders that have a population of individuals that they're focused on, whether it's reducing their costs, increasing productivity, or, again, from the perspective of the government should be a representation of its citizens and should have their best interests as a primary focus of its instantiation. And so, all of these various entities that are kind of distinctly interested in their own reasons, but also have a common interest as well, where they can optimize and pool resources to benefit alongside each other, is absolutely an opportunity. And then next slide. Okay, and then the last kind of wrap up here is now community benefit. Why, what's the benefits of even doing this sort of thing? Why is this important? And this addresses really the three common themes that I've gone through throughout this: individuals, wellness professionals, and industry or government. From the perspective of an individual, being able to empower them to understand their preventative health, feel they have agency to address their primary risk factors and their understanding of their health status in general, and then helping reduce the number of daily prescriptions being taken, any sort of health outcomes that would otherwise be popping up as a result of preventative health disease risks, to help them feel like they have a better control over their preventative health, reduce the friction points for making improvements, and being able to benefit by living a longer, healthier lifespan. Next, wellness professionals, individuals, whether it's physicians, personal trainers, nutritionists, whatever, being able to optimally interact with patients in a framework that allows both the patient to succeed, but the wellness pro to succeed as well as an agent of assistance and expertise for an individual. And being able to provide tools to the wellness pros to help them better deliver the content of their expertise to individuals in a format that will allow them to succeed is something that we feel really strongly about as a key component to the patient journey over time. And we've got a lot of different wellness professionals that are all doing, really amazing and often disparate things, but they're often rowing in different directions. People are kind of optimizing on different things. So being able to pull them all together and get them rowing in the same direction for an individual patient or a population of individuals, so that you're getting a very big bump in your synergy of what everyone's doing in that chain, allows you to have a much larger impact through time. And a big part of that is, again, providing the framework, software, and tools for those wellness pros to do that, because they don't really have the tools to do that effectively right now. And then lastly, industry and government. Again, population health at this large scale is something that provides very good insight into how our patient health risks changing through time. What are the interventions that are making a difference? Why do they make a difference? What's the current incentive structures that either allow for or inhibit progress for individuals through time? And how can we address those things, whether it's through positive reinforcement or negative reinforcement by whether it's a tax or a increased premium or whatever, or lack of a benefit, to get people all on the same aligned incentive structure, where healthier patients or individuals have higher productivity, less sick time, and are healthier, happier citizens as well. But really at the end of the day, this is really the individuals that make up our society, and our companies are what allow human civilization to thrive. And it's really the right thing to do to help as many individuals as possible reach their health goals, understand what they are, and live a healthy, happy, long life to the best of their ability. So that, I believe, covers all of my slides, and I'm happy to take any questions, but I appreciate your time. Thank you.
Awesome. Thank you, Brandon, for sharing. I particularly really like the part about when you were talking about patient empowerment, because I think that is really something that we really need to do, especially with, medical being such a confusing thing and such a complicated thing at this point of time. So the work that we do at Dexafit Asia is really, Dexafit as a whole is really so important, because then we can actually help our patients and our clients learn things that probably only doctors and physiologists and individuals like yourself and myself understand at the look of a data piece, become such readable pieces to individuals who are everyday people, like everyone inside the audience right now. So we have a few questions for you actually. During us, it looks like DEXA scan test and Dexafit test in general is done regularly to compare previous data to see if any changes done is tracked. How often is often? And then in terms of the cost, I told him in advance that the pay structure or the cost structure or investment structure per se is different between the US and the Asia side. So then I gave him our website. So I think maybe you can answer his first two questions per se.
Yeah, so in terms of how often it makes sense, it depends on the individual, right? So when we have someone that has high disease risk based on their baseline data, they need to make improvements in body composition, they need to make improvements in cardiorespiratory fitness. Those are the individuals that need more touch points more frequently. So someone that has a lot of work to do, generally I always recommend, at least for DEXA scan follow-ups, staying within about 8 to 12 weeks, because that's a long enough time frame to see really meaningful change, but not so long where now, 12 months later, who knows what you were doing, 6 months ago or 9 months ago. And again, when people get that first positive follow-up scan, especially when it's been 8 to 12 weeks and they have a lot of progress to do, then now right off the bat, they say, okay, I feel like I'm on the right track. This is going as I expected. I'm really excited. You get that initial positive reinforcement that, okay, I can do this. And then you help maintain that momentum by now saying, okay, now 3 months from now, you're going to be doing your next follow-up scan. We want to make sure that you're maintaining that momentum to the next one. And you want to try to keep that similar 3 to then maybe 6 month schedule for as long as they, or at least until they get to a health status that they feel good about and they feel like they want to maintain. Once they get to the point that they say, my risk is low or at least manageable to a point that I'm comfortable with, I don't really care about getting to as perfect or as optimal as possible. I just want to minimize the bulk of my risk, which is totally fine for most people. Getting to that point and then now doing it perhaps on an annual basis or every 2 years is definitely reasonable. Now, generally we recommend that doing it at least once a year. And the reason for that is because, when you start going to every 2 years, you can actually make some pretty negative progress within that time frame. And so for someone that's very stable year in, year out, doesn't really matter. They can do it whenever it makes sense to them. They've got a good model for how they need to be executing behaviors to help maintain their health status. But if you're someone that's more variable in your health status, it's tough to maintain a consistent weight, or at least within a tight boundary. And that you kind of go up and down with whether it's seasons or life events. Being able to do it on a year-to-year basis to make sure that you're not getting too far outside of the bounds of what you've established as your kind of comfortable risk zone helps prevent things from getting too far away from where you are to where it's a much bigger undertaking to get back to that health status that you're comfortable with.
Awesome. Jorim says thank you to you. So Ravinda asks, what is your youngest and oldest age you have tested? So over here at Dexafit Asia, Jimmy has answered that our youngest is 19 and our oldest is 71, but I feel like the US side has more, right?
Yeah, I think probably, at least from what I'm aware of, maybe like 13 years old or so. And then the oldest, I don't know off the top of my head, certainly in the 80s, potentially in the 90s as well. We've got quite the range. Now, when it comes to individuals that are younger, it is actually a really good opportunity, particularly from the time that they hit puberty to anytime after that, to start getting those baseline scans, because it gives us an idea of, okay, when they hit puberty, this is how their body has now developed as they reach their peak maturity, and then now tracking how that progresses through time. Generally before puberty, it's a little bit more difficult, or at least less valuable, at least in cases of most people. But if it's a really obese child, then it can be advantageous there. But at least prior to puberty, things are just changing so rapidly that any particular scan at that point doesn't really give you that much to go off of, unless they're specifically struggling with obesity from a very young age, where it might be helpful to get them back on track. But from just a very general health preventative standpoint, looking at from the time that they hit puberty to after that is really where that sweet spot window opens up.
So I guess a follow-up question that everyone might have, right, is whether it's safe for an individual who is young to do the Dexafit test. So for example, like DEXA scan has radiation, things like that.
Yeah, so to give you an idea of what the radiation typically is from a scan, most people aren't familiar with these terms, but so the term that's generally used is something called generally gray, GRAY, but in terms of a DEXA, they use what's called microgray, which is just a very small amount of that. So a DEXA scan is usually about 1/2 to 1 microgray, which is equivalent to, in more observable terms, it's called equivalent to 4 bananas, or a banana equivalent dose. And the reason that something like banana is used is because there's a specific isotope of potassium called potassium-40 that has a regular radioactive decay, which produces ionizing radiation, that is within your body when you eat the banana. And 4 bananas is equivalent roughly to the radioactive dose from a DEXA scan, right? Which says more about how low the DEXA scan is in radiation than how high a banana is. Sleeping next to somebody in bed gives you a radiation dose. Just being outside gives you a background radiation dose. So perhaps the easiest way to understand it is that being in an airplane for an hour at altitude is about equivalent to 1 DEXA scan. So it's a very manageable dose, very small. Living at high altitude can often be the equivalent of several thousand DEXA scans per year. So it's very low radiation. And then to go back to the CT example, a CT scan that's often used for coronary artery disease is often roughly equivalent between 25,000 to 250,000 DEXA scans, but in a single dose. So that's where you start to get to levels of radiation exposure that do become meaningful and do meaningfully increase your risk of cancer as a result of the radiation.
Awesome. So basically, if you're able to eat 4 bananas, you're able to do a DEXA scan.
Right.
Okay. Right. So Ravida has one last question. I believe that would be the last question for the summit today. How can you help our society? I believe that Ravida feels that our goal as Dexafit Asia is Dexafit as a whole is very ambitious, that we want to help the health status of the whole world. Yeah. And so he asked, how can we actually help our society, considering that there are different individuals in different health status, and at the end of the day, even if we are priced in an affordable level, there is a certain wealth consideration to be made.
Yeah, that's a really good question, and that touches on that equitable access piece that I touched on. So one of the things that we're really excited about is with our machine learning and AI, be able to expand those capabilities to not require Dexafit testing specifically, right? Now, you won't get the accuracy that comes with doing those tests, but it gives you some level of predictability based on demographic data, and then potentially just blood labs, or maybe just blood pressure, and a couple of components that are much cheaper oftentimes for people to get access to. And in the future, potentially being able to take just pictures of your body with your camera, things like that. So being able to use artificial intelligence to take everything that we've learned from our population of individuals across the globe based on DEXA and VO2 max testing, among other tests, and being able to translate that into a lower specificity and predictive power, but broader access capability. So being able to say, all right, here's someone's demographic data, here's their height, weight, some other components that are easy to access. Here's your disease prediction based on those factors, right? And so that allows you now to go to communities that do not have the resources of wealthier countries, but still give them some level of disease understanding based on their current metrics. And as costs continue to come down with the specific equipment, because as adoption increases, the cost of these systems will go down because there's higher demand, which reduces the production cost. Because most of these equipment manufacturers, the number of units that are actually produced is usually only on the order of often several hundred to maybe several thousand per year, which in terms of manufacturing scale is very, very small. So you don't really get the economies of scale at those levels, but that will change based on large scale adoption. And again, the systems themselves right now aren't that expensive, but from a perspective of very low wealth countries, it's enough of a difference in cost that it actually matters. So being able to scale based on a much larger increase in demand gives you the ability to have larger economies of scale, reduce the cost, and then hopefully being able to expand that equipment infrastructure into these lower wealth countries.
Awesome. That is such a great answer. Yeah. So I guess at the end of the day, we are probably going to be using a mixture of a mixture of prediction data along with things like technology to help improve the life and quality of life of everyone using these predictive models that we are obviously in process of, right? Yeah. Yes, Ian, this will be on YouTube, but give me some time to actually record this and re-render it out. Yeah. Okay, I believe we have come to the end of our Dexafit Summit 2022. Thank you so much, Adam and Brandon, for joining me in for this summit and to share with everybody about what Dexafit's all about, what's in store, what has been done before that, and really what's going on in future. I'm so happy to have you guys as my co-presenters today, and it has been a really enjoyable time. So If you can, everybody just pop in a thank you to Adam and Brandon, just to give them a quick encouragement before we leave the room. And I thank you so much, guys. We will probably be sending all of you a quick email to thank you all and ask you for some feedback. Yep. So I think we can all end here today. We probably overrun by a bit. Yeah, but I'm really, really thankful that some of you really stayed back to just listen to this little last bit. Yeah, Brandon must has been really, really enjoyable to listen to. All right. Okay. So we are gonna end over here. Thank you guys, and I will see you go soon. Bye.